Hey, so I ran across a bunch of questions online about peptide therapy and specifically BPC-157, and I am about 90 days out from the beginning of my cycle. So I did 1 month of BPC and now I've been off of it for 2 months, and I wanted to maybe clear up some of the confusion and help some people out who were in my position that I was in 90 days ago, and hopefully you could learn something a little bit from my experience. And I also wanted to mention that this is from somebody who actually has a phobia of needles. Well, I won't say it's really a phobia. I had a couple doctors tell me there's a name for it. It's called vasovagal syncope. I have no idea if I'm pronouncing that correctly. But from what I understand, basically, some people, just out of genetic luck, I guess, when you get an injection, your body freaks out and you have some kind of nerve called your vagal nerve. And, maybe somebody who's more experienced with medicine can explain in the comments, but it makes you pass out. It's really embarrassing. And I have that. I pass out when I have anything to do with needles or see blood. So if you're in that same position, I'm going to explain to you my experience with it, and it really wasn't that bad. So first off, what did I start taking it for? So I actually had 2 injuries, and they happened about 6 months apart from each other. The first one, I think, obviously I don't know exactly when this happened, but it's a torn labrum, and I'll show the report after I show the image, but specifically it's the posterior inferior labrum. So on my left shoulder, in the back, I tore my labrum doing combat sports, and then the other one is I have a broken collarbone, and I had to look this up because it's all medical terminology, but it's the end of your collarbone has a bit called the distal part, and that broke and it didn't fall off. So it's called non-displaced. I'll go ahead and I'll put the report up now. So here's the report, and basically, there's a lot of medical jargon that I don't fully understand. The orthopedic guy was telling me all about it, but it was 2 injuries. One is the labrum, one is the collarbone. And he recommended either surgery or something like 6 months of rest and physical therapy. And at the time, I had a friend that was telling me about peptides, and I asked the orthopedic surgeon about it. He was a younger guy. He was really cool about it. I said, I understand you probably can't give your personal medical advice here, and that I don't know if it's illegal or not for him to recommend them. But he had known about it, and he said, look, from his experience, there's sort of a 50-50 success rate. He had never actually had a patient use them or ask about it, but from what he's read, the literature that he's read, it works for some people and it doesn't work for some people. And he said, go ahead and try it. Okay, so the first thing I did is I asked a sort of health guru friend of mine. He's a personal trainer, and I went online and read a lot on Reddit, a couple articles, and I decided that I'm probably going to try BPC-157, which seems to be the most popular one on the internet, and that's probably why you're watching this video if you are interested in taking BPC-157. I am not a doctor. This is not official health advice, but I'm going to go over my experience and how I got my hands on it. So I at first called an online peptide therapy distributor that was based out of Texas. I don't live in Texas, and they were not legally able to sell to me. They gave me some advice of who to call, and they told me to call testosterone therapy clinics in the area that are physical brick and mortar near me, or, funnily enough, Botox sites where women get Botox and lip injections and things like that, because they seem to float in that same market of unregulated medical therapies, basically. So I called a couple, and one of the side effects or possible health effects of this that you'll read online, and I really encourage you to look this up because I wasn't that convinced by the lack of literature I saw, is that if you already have a malignant type of cancer that you aren't aware of, right? You have leukemia or something and you don't know about it. BPC-157 can potentially make that grow faster and, kill you, hurt you. So because of that, 2 of the testosterone therapy clinics that I called actually required blood work for me to get prescribed BPC from them. And like I said, I have a really big problem with needles. I actually forgot to mention during the report that when I got the arthroscopy during the MRI, I passed out on the table from the needle that they inject into your shoulder to put this dye ink. So I didn't want to get blood drawn, right? I really have a bad experience with that. I will pass out. It's very bad. So I ditched those and actually found, what looked like a pretty reputable place. It was very nice. It looks kind of like a dentist's office. It was about an hour and a half away from me. The one sketchy part was they had never, sourced peptides for somebody, this particular peptide. And the guy was a hypnotist on the side, which, I'm not trying to stir up any debate here, but I personally don't take that as a serious profession. And I thought, maybe this isn't very good. But the guy was really cool. He was very knowledgeable about it. He understood the term compounding pharmacy, where that's one tip I got on the internet, is that wherever you get this, you want to make sure that it's a compounding pharmacy. I don't know exactly what that means, but apparently that's something that you want. And it was a compounding pharmacy in the United States out of Indiana. I went on their website, and it seemed pretty legit. So how much did I pay? So for the phone call and this further consultation once I bought it to show me how to inject and everything, that was $120 for that. And then for the bottle of BPC, it was $400. So all in all, I spent about $520. That included all the alcohol pads, all the needles that I needed, and the instruction, obviously, on how to do it. So that was fine. So I drove up there. I was terrified. I've never injected myself with anything. I don't do any drugs at all. I don't even drink. The most adventurous thing that I do is creatine, and that's like, you're basically eating sand. So I was really nervous. So I get there. The lady was super cool. And before she went to inject me, I said, "Do you mind if I attempt to inject myself?" And she, thought that was a good idea because she could show me if I was doing anything wrong. So for BPC, you have to inject it subcutaneously, and she wanted me to inject it in my gut. But I had read a lot online that you should probably inject near the source. And so she pinched my shoulder fat, and I injected myself, and I didn't pass out. It didn't hurt at all. It was an insulin needle, which I had never seen these before, but they were very, very thin. I couldn't even feel the needle going in, and I was staring at it. And before this happened, if I stared at a needle going into anybody, let alone myself, I'm out. So it was miraculous. I did it. It wasn't a big deal. And so I was on my way. The bottle was already reconstituted. So many people will buy BPC, and it's a powder, and they'll go through this process of reconstituting it in saline solution to make it so that it's injectable. And what you'll hear about a lot if you go read online about BPC is it's a very fragile molecule. So you can, kill its potency by shaking it up or messing around too much or messing up this reconstitution step. So the lady in Indiana who owns the compounding pharmacy already reconstituted it. It came in sort of a freezer bag with dry ice in it. It was cold. So I could skip that step. Now going on, if I were to do it again, I probably would get the powder and I would reconstitute it myself, because all you need to do is be patient and read a little bit, watch a couple YouTube videos, and it seems like something that you could do yourself. So the bottle, the $400 bottle, was 5 milliliters. It was already reconstituted. When you inject yourself, these needles, they don't have a particular volume unit on it. It's actually literally called units, right? I think this is sort of a diabetic thing to make it a little bit easier for people to understand how much they're supposed to inject themselves. So these were 30 unit syringes, and I filled them up with 25 units. And that was going to happen for 20 total days. So 5 days on, take the weekend off. And so that altogether, that's a month, right? It's 4 weeks. Every weekday, I'm injecting myself once a day for 1 month. I also did physical therapy twice a week, but I cut it to once a week because it was just some guy sort of watching me stretch for $50 an hour. I didn't really feel like that was worth it. I did quit combat sports at the time because it was making it so much worse by doing that. Throwing hooks full force, things like that. It was ripping my shoulder up. It hurt. I could barely drive home. I couldn't shower or touch my hair because of how bad the pain was. But I did continue lifting, and that did still hurt. So maybe that's stupid, but I want to give my honest experience with exactly how I went about the peptide therapy so that if you decide to do this, you can maybe learn from some of my mistakes. Okay, so now I want to get to the actual injection. So I injected every day at the same time at 11 a.m. I work from home, so I didn't have the nurse to pinch my arm. So what I did is I bought at the dollar store those wooden clothespins, what people hang clothes on in a clothesline. And I would just pull my sleeve up and I would pinch, right? And maybe take one or two and pinch some of it. And then I would listen to music really loud so I didn't freak myself out because of the needle thing. Inject myself. And then I would take a massage gun and, blast it for a minute or two, because not every time, but sometimes there'd be like a little bubble where you could see the peptide, and I didn't want to waste it. I wanted it to go, into my collarbone and my labrum, or do whatever it's supposed to do. As far as like pain goes, 9 times out of 10, I couldn't even feel it go in. Like I would have my skin pinched up with the wooden clothespin. I would watch the needle go in, expecting it to hurt when I stuck it in. As I'm watching it, I couldn't even visualize no pain happened at all. I could not feel it. But every once in a while, I don't know what it is, I would stick the wrong spot and it would hurt, pretty bad. So I also moved it around because apparently scar tissue can build up and you don't want to keep stabbing the same place with the needle. Who knows? That's what the hypnotist guy told me. So I just followed his advice. It seemed to be pretty normal. As far as reactions go to the BPC, there's nothing psychoactive about it. I didn't feel high or strange at all. I did feel a little bit euphoric, like maybe I had taken a pre-workout. I would do it before I exercise. So at 11 I would do it, and then I'd take a lunch break at work and work out, and I felt like an absolute beast. Before, when I was still lifting, certain exercises would kill me while I did them, could not induce pain at all. And I would go to the PT and he would have me do the exercises at the beginning that I tested, and I told him the pain level, and we could not have pain happen if I injected before I went to physical therapy. So I started intentionally not injecting until after I got back from physical therapy, just to be able to have a baseline of how well I was doing. That's how effective the pain relief portion of it was. It's really sort of magical. Nothing that negative. I sort of did break out a little bit, like a couple pimples around the area. I can't obviously prove that was because of the peptide, but I don't get a sort of like body acne. And it wasn't crazy like somebody who's on gear or something, but I did notice it, and it did go away when I stopped peptides. So I do think that it was because of the peptides. But as far as the instant pain relief, it felt like if you ever got prescribed those 800 milligram horse tablets of ibuprofen, but immediate. Like as soon as I injected myself, within 30 seconds, the pain was completely gone. And I remember I have 2 injuries. The labrum was torn and the collarbone, and they both hurt a lot. And it was just, I would try to make it hurt, and I couldn't make it hurt no matter what I did. So that's the basic gist of my experience with it. I completed the entire month. I would say that the pain from the shoulder stopped almost immediately, like within the first week because of peptides, and didn't change that much while I was doing it. So now I've been off of peptides for 2 months. The pain has come back. It's not as bad as it was. I can take a shower, but I do feel the injury when I did not while I was on peptides. I still haven't gone back to training. I'm still lifting. Certain exercises do hurt now that did not hurt while I was on peptides. I still think the peptides helped. I think that if I went back and didn't do them at all, I would be worse off now than if I had, but obviously there's no way to prove that. It's completely unfalsifiable. I did choose to do BPC-157. If I had to do it again, what I would change is, one is, from what I understand, $520 is a little bit on the high end for 1 month of this. And again, I am not a medical expert. This is not advice, but I did find a subreddit where this person has access to a chemical testing laboratory, and he will buy samples anonymously from online peptide websites and test them for their purity, and they're incredibly pure, like 99.7% pure of the compound that they say that they're selling. And these unreconstituted powder bottles are like $45 for the same length of therapy that I had. So it's 1/10 of the price. And keep in mind, I have no idea what the purity of this bottle was that I got for $520. Where, if you trust this subreddit, I'm not going to name it. If you are investigative enough, you can go find it yourself. It's not that hard to find. But the reports are legitimate. They have the name of the chemical testing company on the reports, and it is very high purity of the compound advertised. So if I did it again, I probably would go that route. Not just because it's cheaper, that is a bonus, but one is I want to reconstitute it myself so that I know that it's not damaged in shipping. The molecules are not damaged in shipping. And two, understanding the purity of the thing that you're injecting into your body, unregulated thing, that is important to me. And just trusting this compounding pharmacy in Indiana. I'm not dead. It did work out. But, maybe one day there's going to be a bad case that you see an article written about because somebody trusted the wrong person. So I'd probably do that. I would probably also stack it with TB500, which is another peptide that is commonly stacked. The reason that I did not choose to do that the first time is 100% driven by my fear of needles. And had I known that it would be as easy as it was, right off the rip, I would have got the BPC-157 and TB500 stack, and I would have done them both. That's 2 injections a day. So that's about it. If you have done peptides, let me know what your experience is. If you have questions for me, leave them in the comments. I'd be happy to answer them. A friend of mine had done pentosan for some osteoarthritis in his hip, and he says that it's even better than BPC-157. So if you've ever done something like that, a more exotic peptide, I'd be interested in hearing your story. But yeah, let me know if you like this video. Hopefully you learned something from it. And yeah, I'm willing to talk more about it if there's some things that I left out, that there's enough content for me to make another video. But yeah, I'll see you on the next one.